So gout is an inflammatory arthritis. So it tends to affect joints but can affect other areas. So gout is caused by an increase in the uric acid in our bloodstream. So we all have uric acid in our bloodstream, but some of us have more than others, and it's something that can fluctuate from day to day and over the course of the day. So gout can be caused by a number of different things. So sometimes people will say salty foods can cause it, sometimes caffeinated beverages. There are also foods that we eat that are high in proteins, and those can break down and cause hyperuricemia or high blood uric acid. So the pathology comes from that elevation in the uric acid, and once that uric acid elevation gets high enough, it can cause an inflammation. So the way that this happens in our body and why it's most prevalent in the foot, and particularly the big toe joint is the most common location, is that it's a cooler part of our body. So imagine you're making a rock candy. So you take a container of water and you heat it up, and that warm water dissolves lots of sugar into it. And then as the water cools, it forms crystals and we get the rock candy. The same thing happens with uric acid in our body. So if that concentration of uric acid is high and it goes from the core of our body down to the periphery where it's cooler, those crystals start to form out of the solution, and that tends to happen in the joint to the big toe, and then that causes an inflammation to occur. So one of the problems with that inflammation that happens is the crystals that form cause an inflammatory response. So our body realizes that those crystals are there, and it sends mechanisms to that area to remove the crystals, and that causes inflammation. So our body realizes that it's foreign and attacks it. Problem also is that those gout crystals are like sand, so they're very abrasive, and once they're inside the joint tissue, they actually grind and wear away the cartilage. So that causes another problem, which leads to arthritic problems. So that can advance that arthritis much faster. So it's a little bit different mechanism than osteoarthritis, or what we would think of as like wear and tear arthritis, or the arthritis that we all get with age, which is just that repetitive motion of the joint grinding over time. And once that joint moves enough and enough repetitions, it starts to wear the cartilage away that way. So the end result can be similar, but the way that we get there is a little bit different. Differentiating between gout and regular arthritis can sometimes be challenging. Many times we'll have an opportunity of seeing an acute gout flare. So if we're seeing somebody come into the office and they've had a sudden increase in their pain, then that is sometimes a clue that we have an inflammatory response happening, or inflammation in the joint. So if somebody comes into my office and they say, yesterday this wasn't hurting, but this morning I woke up and my foot was swollen, it's red, it's hot to touch, it hurts to move the toe at all, then those are going to be clues that I'm going to be thinking about gout as a higher clinical suspicion. So if, and this may be something that they've noticed has happened multiple times. The other thing is I might ask about family history. Has anybody else in your family had gout? And many times it runs in families. So a little bit more common in men than in women. So the other parts of arthritis that might kind of differentiate between arthritis and gout is it tends to be kind of a low grade pain that gets worse over time. So if somebody comes in and they say, my toe has been hurting for the past 3 years, and slowly over time it's getting worse, and the more activity I do, the worse it gets, then those are telling me more likely that it's wear and tear type arthritis and the joint is getting worn down. Gout treatments we kind of group into acute grouping and treating the underlying disease. So obviously the elevation in the uric acid is the problem, and we want to get to treating that. So sometimes we counsel patients on food groups that might be things to avoid if we identify that, there's a potential risk that food is causing this. So there's some classic ones that we look at, like alcohol, beer, cheese, wine, red meats, and things that are high in protein can cause gout flare to occur. Also, lots of caffeinated beverages, medications like diuretics. So we want to see if those are a possibility for contributing to that elevated uric acid. So many times we can't change those things. We still have to eat and drink, and many times we identify that probably the food isn't the biggest component. Sometimes it's the kidney problem, that their kidney is just not excreting enough. So, but the end goal is we want to reduce that uric acid. So if we can through food things, that's great. If not, then sometimes we have to look at medication options to help the kidney to excrete more uric acid. And so there are really good medications to do that. They've been in use for many, many years, and we have a really good clinical record with them for helping to reduce that uric acid. So we usually check the uric acid, see if it's high, start some medication, and then we check it after a few weeks to see if we're brought down to a level that's safe and is going to prevent gout flare. And then it's usually something like a maintenance dose that continues so that we keep it under that level.